demand is skyrocketing for booster shots and rapid tests as people head into the holiday period. But many can't get their hands on either or are being told to wait. Does Canada have enough supply of boosters and rapid tests to cover everyone? Philomena Tassi is the Minister of Public Services and Procurement. She's in Hamilton. Thanks for joining us, Minister.
My pleasure, Paul.
All right, so if we could have you maybe just lay it all out for us. I mean, how many vaccine doses does Canada currently have between, counting everything, between the provinces and the federal stockpile? Where are we at?
So let me begin by saying this, that the supply is there. We have enough doses and enough boosters to vaccinate every eligible Canadian who is able to receive a vaccine. So to date, we have just under 5 million Canadians have stepped forward in order to receive their booster shot, and that's fantastic. We now have on hand, on Canadian soil, 20 million boosters that are available to vaccinate the remainder of the population. In addition to that, millions of vaccines and boosters are arriving over the upcoming weeks. We're almost in January. We have, thanks to Minister Anand, my predecessor, strong procurement provisions in place for the vaccines. So the bottom line is that supply is not an issue. We have the vaccines here so that every eligible Canadian can receive a vaccine. And we want to encourage all Canadians, of course, to roll up their sleeves and to get their vaccine because we know it's the best way to combat COVID-19.
I wonder if people, when they hear that, they hear the word eligible, because what, of course, is happening is the age groupings are being broadened. So when you say every eligible Canadian, when more Canadians become eligible, which is, I think, a safe expectation, do we have enough? Are you taking that into account, I guess is the question. Do we have enough for everybody when everybody is eligible?
So that's an excellent question. We are always looking forward to ensure that we have enough vaccines. And if more vaccines are needed, we want to be in a place where we absolutely have secured those vaccines. So the example that I would give is on the pediatric vaccine file. Prior to the pediatric vaccine being approved, for ages 5 to 11, children 5 to 11. We had the agreement with Pfizer. Within 2 days, I was so happy to be able to receive the first batch of those doses at the John C. Munro International Airport right here in Hamilton. And we had 2.9 million vaccines in Canada within 1 week of approval being obtained for those vaccines. So we're always looking forward, and so we should. So in terms of the procurement, I will give you an example. With respect to Pfizer for 2022, we have 35 million vaccines procured with options for another 30 million. With Moderna, we have 20 million vaccines in 2022 with options for another 15 million. And then, of course, we also have suppliers who are waiting for approval. So the message that we want to give to Canadians is we are always going to be looking ahead, and we are going to procure and secure enough vaccines to keep every Canadian safe and those that are eligible to receive them.
And just to be clear, not to draw too fine a point on it, but we talk about boosters, but there are also all kinds of Canadians that still have yet to get themselves fully vaccinated. So are you saying that there, not to be absolutist about it, but that there absolutely will be enough, there are enough for all shots for everyone?
Yes, for all eligible Canadians to receive. So those that have not received any vaccinations, who haven't come forward yet, there will be enough for them to get their full complement of vaccinations, first and second dose and booster. Yes.
Sorry, will be. When?
So we have those,
Okay,
we
that's
have
right,
those
gotcha.
vaccines now.
Okay,
yes.
gotcha.
So what I say, the reason I say will be is because, now we're looking at vaccines for children 0 to 4. We have 5 to 11, but now we need 0 to 4, right? So as the eligibility comes on board and and those vaccines get approved, we are always going to be in a position where we have enough vaccines to vaccinate all Canadians that are eligible. And that's the position we are right now in. So I don't use the word eligibility to sort of skate around the issue. It's for those that are able and eligible to receive vaccines. We have enough vaccines in order to provide those to every Canadian. Yes.
Gotcha. Let's move on to rapid tests, Many Canadians are scrambling ahead of the holidays, trying to get their hands on these things. In Ontario, they seem to evaporate effectively as soon as they were made available. Why do you think the rollout of rapid tests has gone so poorly?
Well, I would say that our procurement efforts have been strong in this, and we have been working with provinces and territories every step of the way. So up until November, the end of November, so November 30th, we had distributed 85 million rapid tests to provinces and territories. And that was actually enough to respond to the requests that they had asked for, that they had put in. Now, I will say in the last month, that demand has ramped up, and understandably, rapid test is just another tool on top of the many tools that we are putting in place and that we are providing to provinces and territories. PPE is another example, therapeutics. So this is just another tool. And what I would say is that from a federal perspective, our procurement has been strong. We've been working very closely with provinces and territories on this. By the end of December, we're having an additional 35 million this month. So by the end of December, it'll be 120 million rapid tests.
But they've disappeared.
Which,
I think what people, sorry to jump in, but people can't get them. I get it that they're there and there's a degree of provincial responsibility in terms of the rollout, but was there a potential or a need for some federal oversight on the rollout? Because people just, they're lining up for hours and they still can't get them, even though, as you say, they're there. They're in the country, right?
Yes, they are. And there are more that are coming. And so what I will say is there has been a demand, a more recent demand from provinces and territories to increase the number of rapid tests. And so to date, we've actually procured 292 million rapid tests in order to meet that demand. You will recall that Minister Freeland in her fall economic update provided $1.7 billion for rapid tests. That was 180 million rapid tests that we can procure. So we are doing our work in the procurement piece. And we want to support provinces and territories every step of the way with respect to how they roll those out, but understanding that that's really provincial jurisdiction to the extent that, they provide the healthcare services. We provide the procurement and provide them with, as we do with vaccines. And we want to support them with the rollout. And so, this is something that I feel very good that we've responded to their asks and provided them with these tests because I think that these are a really important tool as we move forward.
Big news today out of the U.S. The FDA approved Pfizer's COVID-19 antiviral drug, which can be used to treat people infected with the virus. Canadian government has an agreement with Pfizer for, I think a million courses of this?
1 million.
How
That's
soon?
Correct, yes.
How soon will this drug be available in Canada?
Well, listen, that it has to go through regulatory approval, and we don't. We don't want to rush that process because we want to ensure that the process that is undertaken is one that can really say this is a safe drug for Canadians to take. So we don't want to push that. So we're waiting for Health Canada to approve it. I'm just really happy that we have procured 1 million doses or treatments, I should say, for in this antiviral, because again, this is another tool. We have to remember that what this will do is it will lighten the burden of the hospitals with respect to people that are getting sick with COVID and going into the hospitals. In its efficiency, it will minimize the impacts of COVID-19 and keep people out of hospitals. So we're really happy about being able to procure that. And of course, we wait for the approval to come forward. And
I respect
know
that
this is.
I know that takes time, but can you put a number on it? Like people are curious. Like roughly speaking, how long does that process take? When can Canadians expect this to be available?
Yeah, that's hard to say. I mean, I can't really say that. I can say that it's in there, that Health Canada knows that we really want this approval because we want to be able to have this other tool. So we anxiously await this approval. And but I don't want to commit to a date, but to say that we've procured it, we're waiting for the approval. They have put in for regulatory approval, and really look forward to the day where it is approved.
Can I just ask you quickly about PPE? A lot of smaller Canadian manufacturers of PPE are upset that the Canadian government is buying from major internationals instead of small homegrown companies. How do you respond to that?
So first and foremost, I'd say I want to thank the Canadian businesses that have stepped forward. In my own riding, that has happened, where businesses have retooled and pivoted in order to respond to need that was here. And it's because of that we do not have a PPE shortage now. We are in a very good place with respect to PPE. So I want to thank those businesses. And I would also add that 42 cents of every dollar that the federal government has procured on PPE has gone to Canadian businesses. We absolutely want to encourage every step of the way domestic supply. I know that every company would love to have a contract. We're going to continue to support Canadian businesses, and we thank them for their efforts thus far.
But that's
because they have gone a long way.
That's less than half of every dollar. You say 42 cents of every dollar. That's less than half going to Canadian companies.
Right. But what I would say, Paul, is it's really important to remember that when we first were in this, when COVID-19 was upon us, we had to get PPE that kept Canadians safe, particularly those that were like frontline workers who needed masks, who needed gloves. And we had to ensure that we could procure that PPE because we were not going to be in a position where they were left unsafe. So that involved us going beyond domestic capacity because the domestic capacity was not there. And so that was a commitment that we had made to Canadians. And I think the absolute right decision, because we weren't going to have frontline workers who are risking their lives to take care of us.
Agreed.
But we weren't be able to afford them.
I think they would agree, but they would also, I think, be hoping for a commitment now that you can increase that was then, but this is now, and that the ratio can be improved in favor of Canadian companies.
So listen, I agree with you 100%. We are always working to improve that. We always want to scale up domestic production and secure domestic PPE, medical equipment, even vaccines. So we are absolutely looking at ensuring to do whatever that we can in order to secure PPE from Canadian companies. If you look at companies like Medicom and 3M, we have now entered into agreements with them. And we're going to continue to do that. Where we have domestic capacity and production available, we want to support our local businesses.
Will you commit to it, though? And sorry to press, but will you commit to increasing that? As you know, wanting to is one thing, and committing to it is another.
So I would say that if the supply is there, then of course we have a fair and transparent and open process for procurement. We put our procurements online so that, you know, that's readily available. But the commitment to ensure that Canadian businesses are supported, absolutely. We want to ensure that you know, they are provided with opportunities. And I, as procurement minister, am going to continue to look for ways where we can make procurement for small businesses easier. We are in the midst of consultations with respect to that. But of course, the long-term goal is always to support Canada and Canadian companies.
All right, Minister, it's a tough time for everyone. I appreciate you taking the time with us today.
Thank you, Paul. Thank you so much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.